We know that in this country, depending on where you are, Black women are 3 to 4 times more likely to die in pregnancy-related deaths. What we are hearing from some of the more devastating cases are recurring themes. People are not listening to them. Previous harm, engaging in systems that have been harmful. And so wanting to be a part of that change, creating and be an example of like, hey, things can be different. Let's do it.
We review cases of deaths of pregnant people who died during pregnancy or within 1 year. And one of the themes that was coming up over and over and over again was that people were lost in the postpartum. We were seeing over and over again these cases where something could have been done. What can we do to make people feel cared for at this time, where right now so many people feel abandoned, forgotten, and left behind? By having those listening sessions and doing that data analysis, we came to home visiting.
You got to be a little bit of an adrenaline junkie to be a midwife, because you never know. You got to be prepared for any scenario, especially like if you're a first time parent. It's like, whoa, like y'all told me about birth, but like actually experiencing it can be a very much scary, out of body, anxiety producing experience.
Currently, we are providing home-based postpartum care. We are doing the 2-week couplet, so like the mom and the baby at home, and then the 5 to 6 week at home.
Does she spit up a lot?
I haven't watched it in so long.
So this visit is gonna be just like a office visit, but in the comfort of your home, okay? And so Emery's a week old now. Tell us about your birth and like how you felt about your birth.
It was rough.
Okay, yeah.
But I don't know, I think I did good overall. I really didn't know what to expect. So
Any headaches, blurred vision, pain up under your right rib cage? Now we done had a whole baby, got a whole human we taking care of. It sounds like you got support, but how are you feeling like mood wise?
good.
Okay. Her umbilical cord is still drying up. It'll come off on its own. All right. So 6 pounds, 14 ounces, which is still great.
When we were designing our focus groups, one of the things that collectively was important is that they are facilitated in a racially congruent way. That if we're going to talk about racism, it needs to be within a community that has a shared experience. That if we're asking Black birthing people, that it is a Black birthing person who is asking those questions. But then we had to spend a lot of time thinking about, well, who is the person who is home visiting? How might the characteristics of that healthcare provider impact the uptake of an intervention that we're offering?
To, all right, who's scheduling these individuals? Do they have to be in a special template in our EMR to make sure that we can count them? Speaking of counting them, QI, how can we make sure that we are, accurately capturing who we're seeing? Are we using the right codes? Are we getting paid for these visits? We want to write papers about it. Like, what are the things that we need to add for that? We're at year 2. What's going to be our continued funding?
How do we continue to design a program that is more trustworthy, and how can we do that over a long arc?
Yeah. Good stuff.
One of the ways that the research arm of this project will become really important is the way that we can demonstrate medical necessity for meeting people's needs, particularly people who have been marginalized structurally, economically, socially, and racially in our country right now, who are experiencing worse outcomes based on the way our country has racialized and marginalized people of color, and specifically Black birthing people. It is incumbent upon us as a healthcare system to meet needs in place, in the community, in a trustworthy way. And we need to fund and reimburse that care at a level that we are not burning out our healthcare providers, that they have the space to show up fully present, not rushed, ready to listen and ready to connect, so that people can experience that feeling of deeply trustworthy, connected, and joyful care.
We really, really focus our care to be patient-centered. trauma informed. And this community particularly is dealing with chronic stress, trying to survive, trying to make it, higher rates of PTSD, abuse. When I think about how transformative we can be with families who, maybe have had previous harm, it just allows them to be open in a lot of different ways that they are not always able to be.
You're welcome. Thank you for letting just be a part of this journey. From pregnancy, the birth, and postpartum. Yes.